Thyrotoxicosis and adrenal encephalommas are common endocrinological problems that face us in multiple settings. The question is, can we apply telemedicine follow-up in these patients? Our case is an interesting one in form of combining two different etiologies that can explain the patient's symptoms, which were gestational thyrotoxicosis and adrenal encephalommas with suspicious of pheochromocytoma. So while the patient was admitted and the management was done in form of medical management for thyrotoxicosis and DNC for hair complete mole, the patient needed follow-up for multiple reasons. Uh, main reasons as an endocrinologist is the follow-up for her thyroid function test status post the DNC, and also for preoperative management in case of pheochromocytoma and adjustment of blood pressure medications. The patient was outside our city and she was living around 800 kilometers. So we used telemedicine for follow-up. First one, we use telemedicine to contact the patient twice weekly to adjust her antihypertensive medications in case of that the patient proven that she has pheochromocytoma, to take time preparing her for surgery. The second thing is the patient was doing her thyroid function test on an affiliated lab, and we were reviewing her and adjusting the methimazole doses accordingly. Our conclusion in this case report showed that telemedicine was effective in form of saving the patient the troublesome of traveling for a long distance, decreasing the costs for this patient, and prepared and controlled her BB blood pressure stable before the surgery without the need to come to the hospital. This study and the other studies in the literature support the use of telemedicine in management and follow-up of thyrotoxicosis and preoperative evaluation and management for pheochromocytoma.